and welcome to the Wellness Exchange. Today we spoke with Dr. Audrey Gutierrez from South Texas Health System's Clinic of Family Medicines. We spoke about women's health and preventative measures. We hope you enjoyed today's video, and if you haven't already, please subscribe to our YouTube channel and make sure to like this video. Thank you so much for being here today.
No problem.
Awesome. So today we're going to be discussing women's health. So one of the first questions that we have is, what are some leading health concerns or diseases among women nowadays, would you say?
So cardiac is definitely number one, just because, women also have hypertension, diabetes, that lead to cardiac factors, right? Of course, during COVID has been a big one, hopefully we see numbers start to go down. And then just cancer in general, right? Whether that be breast cancer, cervical cancer, uterine cancer, and then all the other types of cancer that factor in.
Yeah. Okay, so heart disease really is that top one.
Yes.
Yeah.
Yes.
And that affects is there a percentage or just that's like the leading cause, right?
That is the leading cause.
Wow.
Yes.
Okay. What are some ways that women can find out if they're at risk, maybe for any of these health concerns?
Sure. So it's important to go to your doctor, at least on an annual basis. Yeah. No matter what age. And so we get fasting labs, which checks, your cholesterol, your liver, your sugar, your kidneys, your blood count, just to make sure that we're not seeing anything bad. And of course, we check your blood pressure at the visit as well, and then do an exam, heart and lungs, that sort of thing.
Awesome. So really just making sure that we go to our doctor, right?
Exactly.
That's the number one thing. Sometimes it's really hard to get some of our family members to go, but at the end of the day, that's where you're going to find out, versus Googling things like.
Exactly. And the thing is, honestly, a lot of these things are silent for a long time until they get severe. Right. And so we want to try to prevent that from happening in, our patients if we can.
So really it's about going to the doctor before anything gets bad as a preventative measure.
Exactly.
Right? Awesome.
Exactly.
Okay. So speaking of prevention, are any of these health concerns, preventable, or are mostly like heart disease and cancer, are they mostly genetic?
So a lot of these things are preventable, right? If we're able to control the blood pressures, we're able to control the sugars. If we do, your screening mammograms, your screening pap smears, per the guidelines, we should be able to catch these things, hopefully early on. There are the few cases, that the genetics is just a very big factor. And, those cases are definitely more rare. But definitely these things are preventable, depending on exercise, diet, and your just day-to-day activities.
Right. So really lifestyle factors do play an important role.
A lot.
And I'm sure also like stress levels and, all of that as well.
Yes.
Wow. Yeah, well, that ties into blood pressure, right? And hypertension. So awesome. So talking about like lifestyle factors and everything, depending on whether a woman's lifestyle is, really great or maybe a little less great, how much can that actually affect her health?
A lot. So, if a woman is not, trying to eat the nutritious foods, right? Eating more fast food, eating the processed junk food, greasy, fried, fatty things. It not only normally affects your blood levels, right? With your cholesterol and your liver, but it just makes you feel bad, right?
If you're lethargic.
So if you're not putting the good things in your body's not going to respond back well.
Right.
If we're not hydrating correctly, again, we're going to feel fatigued. We're not going to have that energy. Our skin's going to be dry. Our hair can be dry. And, just things that can definitely be fixed with, just little things here and there.
Right.
And like I like to tell my patients, I don't want you to do a 180. Right. That's not sustainable, right? You have to change things slowly to make it a part of your daily activities where it just feels normal. Right. At that point, but it makes a whole bunch of difference.
Definitely, I can definitely see that. And I think making those little changes, like integrating more water in your day, like those are, like you said, sustainable to where, like if you try and completely start, I'm going to start working out every single day and I think that goes back to goal setting, right? So making sure that those goals are achievable and measurable and everything. But yeah, very, very true. And then also, so we mentioned food, we mentioned physical activity, stress, you know, making sure that stays low. And I'm sure there's so many aspects to wellness in general, that I'm sure that all of those little parts of it, whether it's, you know, occupational or with social even, right? Making sure that you're staying social and not getting depressed, you know, from being lonely and stuff. So, yeah, a lot of different factors there. So how often should women, I know you mentioned screenings and stuff, how often should women be getting screened for different health issues, you know, breast exams, pap smears, or just regular physical exams?
So anyone below the age of 21, you want to go ahead and get your annual exam. Now once you hit 21, that's when we start to recommend to do pap smears. And then just depending on how your pap smear looks is how often you need to go back.
Okay.
You know, when you're young, we recommend anywhere, you know, between 3 years. Once you hit 30, we can definitely space that out to 5 years if everything looks right.
Right.
And then as far as, you know, mammograms or breast screenings, I mean, your doctor can do a breast screening every year on your annual if you want to. But as far as mammograms go, we recommend normally starting at the age of 40, 45, depending on what guidelines you're going by. And then doing that every 1 to 2 years, depending on, again, what your outcome of the mammogram is.
Right. And I'm sure, of course, that also depends on family history. And I'm sure, like, as a physician, you obviously take into account all of the family history and everything. Yes.
So there are some women who have, you know, genetic factors like the BRCA1, BRCA2 that run in their family. We do tend to screen them much earlier than our general population when it comes to breast cancer. And they can even have more risk of even like uterine and ovarian cancer as well, which are things that we normally don't typically screen for.
Oh, okay. Okay, so definitely consult your physician.
Yes.
So now, I know you mentioned that there is different age brackets there, right, for getting or for beginning those screenings. For a woman who is going through menopause or is going to start going through menopause, should they still, you know, attend their visits with their OBGYN? Should they continue with mammograms or pap smears? I feel like maybe sometimes if they think, oh, well, I've already gone through that period of my life, maybe I shouldn't have to go to the doctor anymore. You know, I'm done, right? So would you still recommend obviously going to the doctor and everything?
Yes, still recommend going to the doctor. I mean, whether that's your family physician, whether that's your OB, because you have separate problems when you're going through menopause.
Right.
And it's good to make sure that you're telling your doctor about these things. Now, you know, when it comes to, you know, checking for mammograms, pap smears, if you've had a normal pap smear in the last 10 years, you do not need to continue getting that after the age of 65.
Okay, good.
Mammograms, if you've had normal normal mammograms for most of your life, especially in the last recent years, you honestly don't need to get them past the age of 75.
Okay.
Now, that is definitely a discussion between you and your doctor.
Right.
Now, I have patients who they want to continue getting screening, and that's their preference. I have some patients who say, oh, yes, I'm finally done with this.
Yes.
But those are the guidelines when it comes to that. But honestly, it's good to just have that conversation with your doctor. And you know, during menopause, some of the things that come up, of course, is you know, vaginal dryness that can affect you. Sometimes we see more of this like urinary incontinence where you can leak a little bit more urine. You feel like, you know, maybe your skin's getting a little bit too dry and things like that. And there's medications for that, but again, risks and benefits with talking to your doctor about that. And see maybe if there's other more natural, you know, vitamin supplements, more exercise type of things to do to try to help with those symptoms.
Awesome. Yeah, and so again, with those, you know, those little lifestyle factors could maybe have a bigger role. And I'm sure doing other preventative things early on can help prevent some of those things later on.
Yeah, because if we know about them sooner, we can try to, you know, see what we can do about it sooner versus later.
Right, definitely. Once it's, you know,
a little bit further along.
Awesome. Okay, so would you say, kind of moving into that different age range also, if a woman thinks that she might be pregnant, what are some of the first things that she should do? You know, I think a lot of people kind kind of might depending on what stage they are in their lives, they're either going to be super excited or they're going to maybe panic, you know, if it's not something that they had originally planned for.
Yeah.
So what would you say some of the first things to do?
So the first thing I would do is go to your doctor.
Yes.
Okay. We want to confirm that, you know, we do have a positive pregnancy test. And then what's really important is actually getting your first ultrasound in the first trimester, which is less than 13 weeks. Just because we know that that's when we're able to get the dating the best. And so it gives us a better idea about when the actual due date should be.
Oh, wow. I didn't know that.
Now, of course, when you find out you're pregnant, you also want to make sure that you start your prenatal vitamins. I counsel my patients, you know, who are trying to get pregnant, even who are not, just to be on a daily vitamin or prenatal vitamin, because sometimes accidents happen.
Of course.
And so if you're already taking that, you're fueling, you know, your body to prevent spinal issues in baby. With that folic acid that you have in there. Now, if this is an unplanned pregnancy, again, you know, this is a talk between you and your doctor, you know, what the next steps are, you know, and that's completely their decision.
Right. Absolutely. Absolutely. Well, awesome. Yeah, those are some really great tips, you know, if anyone finds themselves in that situation. So, so kind of moving on to a different area or a different topic, you know, we know that sexual assault, the numbers for sexual assault are generally pretty high, unfortunately. We see about 1 in 6 women are victims of attempted or completed sexual assault. And so if a woman finds herself in this situation, what would you say is one of the first things she should do, or how should she, you know, go about handling such a sensitive topic or situation?
So it's really unfortunate. I do feel like I hear a lot more of it practicing here now. So the first thing you want to do is get to a safe place.
Yes.
Okay. So you want to call someone that you trust or go somewhere that you trust, just to get away from that environment. Second, you want to make sure that you're being protected physically. So whether that's going to the hospital to go ahead and you know, get an assessment, you know, whether that's trying to prevent a pregnancy that's unwanted, you know, there's medications for that. But getting, you know, your physical health checked. And then, you know, you can definitely decide to report that to the police. So that would be more of like the legal stance. And then, of course, just your mental health, right? So whether that's talking to your primary care doctor, seeing a psychologist or a counselor, something like that takes even not just a toll on the mind, but a lot of the times on the body. And so we see a lot of these physical findings that, you know, we really can't find anything, but, you know, this assault or the sexual assault that they had, or anything, honestly, in the past as far as abuse, can really start to affect them physically.
Yeah, no, definitely. Then that's something really that, I mean, that we want to make sure that anybody in any situation, regardless if it's any of our employees or anyone that they know, you know, has access to resources if they're ever in that type of situation. Unfortunately, we do see it, you know, quite often, but I think it's really important to know where to go, you know, how to handle, and of course, in the moment, there's so many feelings, emotions, adrenaline, you know, so just making sure, that you, like you said, get to a safe place, you know, find someone you trust, and that when that may be, you know, the hospital, the police, or anything. So awesome. Well, thank you so much for that. And so kind of we've covered a lot of topics, you know, and I feel like we could really sit here for all day and really talk about these topics, just because there's so many aspects that you can elaborate on all of them. And as a physician, I'm sure you see quite the array, you know, every day. But I guess just to kind of round out our discussion today, in terms of the recent events with COVID and everything, have you seen any kind of like major trends or changes among women's health kind of due to the pandemic?
Yeah, so I mean, women are normally the caregivers, right, of the family. They make sure that dinner's on the table. Their kids are getting to their activities, or that they're doing their homework, schoolwork.
Right.
So women have taken, it's been a big mental health issue, I feel. Because the kids were at home for a long time, and that's something that you have to deal with.
Yeah.
I've seen a lot of women, gain weight because they're not taking care of themselves. They're not eating correctly. They're not being as physically active anymore. And so honestly, it's been mental and physical that I've seen as far as COVID, having that change in their life.
It's a complete lifestyle change, right? I mean, some people were going from working in the office to completely working from home.
Yes.
And then their kids are at home now, or they don't have kids and they're at home alone,
Right.
So definitely a lot of factors, but really finding out what situation you're in and talking to your physician and seeing how,
exactly,
if you need, more social gatherings, to and unfortunately we're still in the battle, of the pandemic, but trying to see, I guess, what the best path is for each individual.
Yes.
So I just have one last question, really just if you have any type of advice or anything that you would like to share, with our female employees, that just to kind of round out our conversation.
Yeah, just take care of yourself, and that means mental, physical, spiritual. If you have that part of your life, and then your doctor should be able to kind of help you through these things, or other specialists, like psychologists or psychiatrists or even nutritionists. So we want to utilize everyone we can to make sure that you are having your healthiest, best life, and living life to the fullest.
Yeah, definitely. Well, thank you so much, Dr. Gutierrez. We really appreciated having you here and discussing these really important topics with us. If you haven't already, please like and subscribe to our YouTube channel, and we hope you enjoyed today's video.